I'm Brian, and this is my colleague Shafiq, and we're here to tell you about Matibabu.
We hope to reduce the global malaria deaths by 30% in the next 5 years through early diagnosis.
What you see in this picture is actually what happens when a person goes for diagnosis in a local clinic in Uganda. One doctor attending to over 20 patients, waiting for their blood to be drawn and get a malaria result.
It makes the process tedious, and people end up just taking self-medication, and they end up not getting diagnosed, and they end up dying at times.
A simple malaria test takes about 20 minutes or 30 minutes. That is from the time the blood is drawn from a patient until diagnosis is done in the laboratory.
With our product, in less than a minute, you know whether you have malaria or not.
When a person is infected with malaria, the plasmodium actually changes the chemical and physical shape of the cell. That means it also creates a paramagnetic substance called hemozoin in this cell.
Using principles of light and magnetism, we're able to align this hemozoin in one place, and we're able to shine the light through the blood sample, and we're able to differentiate between an infected cell and a normal cell.
We have two target customers. Our first target customer are the health centers, with over 32 million health centers in the sub-Saharan Africa, and we plan to give these people a robust kit that can diagnose malaria in the health centers. The second customer segment are the individuals. For these people, we plan to give them a diagnostic kit that's connected to a smartphone so they can do personal diagnosis and they can send their results to the doctor.
It's an amazing feeling to win, in that the money comes in handy when we actually going in for the clinical trials.
It hasn't been an easy journey. There are ups and downs.
So one of the major things we've learned is to put the user first. I mean, the initial stages when we're developing, we just do what we thought was right for them and do not get feedback from anyone. But whenever we took it back to the community to test, we found that we were maybe off scope or developing something that wasn't actually usable.
During the journey of research and development, we found out that this device can actually detect other diseases, for example, sickle cell anemia.
This is our first device, so we are learning a lot as we are going. We have to stay innovative and see that we can use the same technology to cover a wider range of diseases and maybe offer a wider medical solution for diagnosis. As a company, we believe in faster diagnostic tools, so that's what we are aiming at giving to the people.